Well, hello everyone. Today we have Emily Blackmore from the Lima Memorial Diabetic Center here to talk about diabetes awareness for Diabetes Awareness Month. Well, thanks for joining us, Emily.
Yeah, thanks for having me, Chris.
All right. Now, can you start by providing some statistics or facts maybe about diabetes to help our viewers understand the impact of the disease in the United States?
Yeah, absolutely. So obviously diabetes is a big issue here in the United States. It's actually estimated that here in Ohio, about 12% of the adult population has diabetes. Here in Allen County specifically, it's actually closer to around 13%. So we're just a little bit higher than the state average. It's also estimated that about 33 to 34% of adults in Ohio have prediabetes, so that precursor to diabetes. So definitely a big reason why we want to try to get ahead of this issue, so we don't have all of these, more people developing diabetes in the future. The American Diabetes Association actually also estimates that medical expenses for patients with diabetes is about 2.3 times higher in patients with diabetes versus patients without. And so there's a big medical cost associated with this disease, and that can be a big problem as well.
Right. And what are the risk factors and warning signs of diabetes that people should be aware of?
So risk factors, the biggest ones that we kind of know about are, of course, family history. So if you have a family history of diabetes, you're at a higher risk. Anybody over the age of 45 is going to be at a higher risk. If you're overweight or obese, if you're physically inactive, and then unfortunately, certain ethnic populations, so African Americans, Latinas, Hispanic people, Alaskan Natives, and Pacific Islanders, and even Native Americans.
All right. And can you explain why early detection and management are crucial for the condition, and maybe what steps individuals can take to monitor their health?
Absolutely. So we know that if we can detect diabetes or prediabetes early on, it's going to be a much better outcome for the patient. This is a chronic medical condition, and we know it's really highly associated with other chronic medical conditions such as heart disease, stroke, blindness, and even kidney disease. And so by detecting diabetes early or even prediabetes early on, we can definitely try to slow progression and then try to help even prevent those other diseases as well.
Right. And for those who are living with diabetes or maybe that have a loved one who is, how can you help them out at the Lima Memorial Diabetic Center?
Yeah, so we can definitely help out here. I provide some diabetes management, so really helping to kind of individualize care plans and help adjust medicines or start people on new medicines to help them out. We also have 2 diabetic educators here in the office, so they can help really provide that education, and we know that that's really important in trying to help slow progression and or prevent diabetes. And so really kind of getting a good educational base to help you better manage your disease over time.
Right. Well, Emily, I really appreciate you coming on today. It is important for all of our viewers to know all about diabetes, the steps they could take, and the information that you can provide for our guests that are watching today. So thank you so much for joining us.
Yeah, thanks for having me again.
All right. Well, don't go away. We have more when we come back.